Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Hi, welcome to Redefining Medicine. Today I have the honor and the privilege of interviewing Dr. Geo Espinosa. Dr. Espinosa, thank you for being here.
Thank you.
He's a naturopathic urologist, and he does marvelous stuff. And I just found out that he doesn't only take care of men, he takes care of women too. So he's going to tell us a lot. He's also written books. He's amazing. And he's at NYU in our backyard. So talk to us.
So you mentioned I see women, and I do, strictly with urological problems. I'm even more specifically with interstitial cystitis.
Right.
Because it's just, look, whether it's prostatitis in men, or orcalgia in men, or interstitial cystitis in women or men, it's all pelvic dysfunction. Okay. And really the form and how you go about that, it's not that different from the other. So that's one area that I dabble in quite a bit. And I've been doing integrative and holistic urology for a long, long time. And I'm very happy that I chose the road less traveled, because who in their right mind would do naturopathic medicine, functional medicine, and say, all right, I'm just going to kind of go in urology. Not too many people would do that. A lot of prostates and penises that I see every day. I always say my right index finger is very, sore by the end of the day. Right. But it's a very fun group, and it's an area that people really need proper integrative health and help. Yeah.
Well, that's what I was going to say to you, You took the road less traveled,
yeah,
but it's a road that needs to be traveled a lot more.
Yeah, I think so. Men are a very interesting gender. You probably know that.
I had a couple of interactions.
They typically don't go to doctors. Things are until an
They're
arm
dying.
is almost
They're
coming
dying.
out of their body, off their bodies.
Mm-hmm.
But I think things are changing because they're a little bit more proactive. And what they're really is not that they don't want to go to doctors. Honestly, they just don't want to go to conventional doctors.
I don't blame them.
Once they see that there are integrative doctors that specialize. With men, it's all about trust. Do you really know what you're doing? Can you really help me with my problem and not just prescribe? And once they get to know the integrative practitioner, there's the trust is there. You have them for life. So that's typically how it works.
On the other side too, where we are.
Yeah, exactly.
It may not happen where you work, but that's it.
Yeah.
No, but that's really important. So tell me how you got there and what you're doing with them now.
How I got there? Well, I just had great opportunities, and there's always some level of luck. Once again, it's like, which integrative doctor would want to go into urology? So I did some training at Columbia University in the Department of Urology with Aaron Katz at the time. And then I kind of earned my stripes because you're natural what? I don't know. What? Are we going to give this guy a shot? I did some research with a few supplements, nutraceuticals there, saw some patients, and they were like, wow, this guy really knows. And is very obviously coming with a scientific backbone. Then later on, I went on to NYU where I met the chairman of the department, Dr. Herb Lepore, which this year, he has 30 years as a chairman of a department. You'll never see that. So we're sort of celebrating that. And he was so into the integrative and functional medicine approach, which surprised me. Here is a guy who has done over 5,000 prostatectomies. So you would think that surgeries, everything, and just hard medicine, as it was referred to before back decades ago, was the only thing he was interested in. But no, he was very interested in the fact that I was able to help men with prostate problems and men with prostatitis, because the trick is or the hidden secret is that no urologist really wants to see
Prostatitis.
prostatitis.
Exactly.
Right? And I said, I'll take them. Well, in
Of
fact, I'm
course.
actually interested.
Of
In
course.
fact, they do well with me. And that some of the prostate cancer patients, even after surgery, right, the recurrence rate still tends to be high, and so we can work with them to reduce the risk of a recurrence. So it's just a very fascinating field that I'm in. That many of our colleagues would say, God, urology, men all the time? Don't you get tired? I mean, the philosophy and the principle is treat the person, not the disease. So I'm always treating the person. And no, I don't get tired because there's always something new, something interesting in the world of urology that I didn't know. And plus, you really get to know when they need conventional therapy. So that's where we're at now.
That sounds amazing,
Yeah.
actually, because you know what? You're the embodiment of where we should be going.
Oh, thank you.
And it's not just, in your case, you chose urology, which is wonderful because urology is really devoid of a lot of, we deal with a lot of men in our practice.
Yeah.
But, we're not, going to the urologist, you're going to send them for a biopsy and they're going to tell them to do a blind biopsy and then do a prostatectomy. But
Yep.
that's not it.
No,
And you
it's not it.
got in to the conventional world.
Yeah.
And you're changing it from within. And
Yeah.
to me, that is the most amazing, most wonderful thing. Seriously.
Thank you.
And
Yeah.
it's amazing.
I do agree with that. All bias aside.
We're
You know,
all
you mentioned, like, for example, biopsy, prostate. Well, how do you know that you need a biopsy?
Exactly.
Do you really need a biopsy?
Exactly.
So there's a whole way of looking into this where now you can say, look, you at this point you do, but what if you don't? I see a lot of men getting unnecessary biopsies. I see a lot of men certainly, and by the way, the naturopath is talking? No, any urologist will tell you that they're over biopsying, any responsible urologist, and they're over treating.
Of course.
Right? It's in the research, it's in the data, and many would admit to that. So who needs what? Let's figure out more closely with some of the tools we have to see who needs a biopsy. Just a high PSA should not trigger a biopsy.
I agree.
And who needs prostatectomy. In another area that I know you like, can a person with a history of prostate cancer be on testosterone therapy?
Of course. When I first started prescribing testosterone,
Yeah.
Morgenthaler
Yeah.
from Harvard
Yeah.
used to send me the patients
Oh, great.
because he had to biopsy them
Yep.
before he could give them testosterone.
That's right.
And I would say, why do I have to biopsy them? Plus, they're blind biopsies.
Yeah.
You're not really finding out anything.
That's correct.
And it's painful. I'm not a guy. You know that? I don't live in a guy's body, and
No.
most of guys don't live in their own body.
That's right. I don't live in a guy's body.
You-
I don't know
you
what
look
body
like a pretty good guy.
You're right.
But this is the thing. It's like, it's painful.
It is.
What are you thinking when you're doing that? It's not okay.
It's not okay. The good news, however, is that if there's a time to have prostate cancer or be biopsied, this is the best time. It's targeted. It's no longer blind in most places. Still, many places do target it. But, I'm in a bubble. I'm at NYU, which is like they do the best of the best. And it's not only NYU, it's the other institutions that do a good job as well.
Yep.
And they do target it. And really, we're all on the same page. Like, who really needs it? I don't want to treat everyone. So, yes, it's painful and uncomfortable. It's unfortunately the only way of diagnosing prostate cancer at this time. But wait for this. And I don't know where this is going. People are asking, is it over? Is there ever going to be a time where we're going to be able to diagnose prostate cancer without a biopsy? Great question. I thought that the answer would be no. It's going to be a while. However, in Germany, they did a research just recently. You're going to love this. They did no biopsy. They did a pelvic MRI plus a PSMA PET scan, right?
Oh, sure.
And if those two
Of
things,
course.
two things came up positive,
Positive,
then they got a biopsy or treated. And guess what? It was a small group, almost 100%. When the MRI was positive and the PET scan was positive, then
Why didn't they think about it too?
well, and it's still, by the way, I'm telling you this is a small trial.
Amazing.
You're not going to see no
Right.
biopsy for a long time anyway. But with AI and things like that, I think in the future, don't know exactly when, there will probably be a time where they will do without a biopsy.
Well, I think that's wonderful. I'm
Yeah.
happy for the men. Tell you,
I'm happy
sure.
I'm happy
sure.
for us.
Yes, I'm
Yeah.
happy for you guys. So what do you do with your patients? Somebody comes in to see you, what do you do?
So it depends what the problem is. You do heal the patient and treat the patient, not the disease. However, you definitely start from the pelvis up, right? So it's always some sort of pelvic dysfunction that's happening. Initially, anyway, I always tell them I need to earn the right to do more. In other words, if you want me to be a wellness doctor, I know that I need to earn that right. Let's fix you here, and then let's kind of keep moving up in other areas. And from a pelvic perspective, I do several things. One is that they see me because they don't trust whoever they're seeing. My PSA is X is high. They want to do a biopsy, should I? So then we go over the steps, and that leads us to figure that out. If they already have prostate cancer, for example, then we figure out what treatments are available. Because there are some that most men don't even know they think it's just prostatectomy and radiation. There's many more. So what else is out there, and am I a candidate? Most importantly, I think, is that I give them a targeted protocol, lifestyle protocol, to create a microenvironment that's hostile to prostate cancer.
Beautiful.
And that is critical, despite what they do for treatment. You know that 40% of men who get treated with either radiation or prostatectomy, within 10 years, they have a recurrence of their cancer. That's insane. And to me, that means that no one is treating the microenvironment.
Of course.
So that's a big component of what I do, and there's 4 pillars to that. There's diet. We could go however deep you want
go
with
for
that.
it. Tell us.
Nutraceutical supplements, sleep, and exercise.
Sure.
People typically ask me, which one of the 4 are most important.
Oh.
I'm like, you're kind of asking me which one of my 3 kids I love most.
Of course.
I don't know. It depends. I mean, do I equally love them every day the same? Probably not, right? Depending who's giving me a hard time.
But they wind up in the same place.
But they wind up. So out of the 4, so with the dietary approach, we have to look at. If we have to go into food intolerances and things like that, we do. For the most part, it's some sort of plant-based Mediterranean. And I don't recommend, it's very important actually, because I know diets are like religion, and you have to be very careful with how you talk about diets.
Not here.
I do not recommend a ketogenic diet for prostate cancer. Very important, because
that makes sense.
Ketogenic diet is a big, it's kind of, when you look around the internet and so forth, good research done in Boston, that it helps with glioblastomas and things. So it may, because glioblastomas is more of a glycolytic type of cancer, where it uses glucose. Prostate cancer is not. And actually, prostate cancer can be lipophilic, which means that lipids and fats can actually promote. Mm-hmm. We all need lipids, and we can get into much deeper than that. The bottom line is that if you do ketogenic diet, which is really a high-fat diet, it's probably not only not good for prostate cancer, but making it worse. So one needs to be very careful with that. Plant-based Mediterranean, a lot of cruciferous vegetables, because those have anti-prostate cancer activity to some degree or another. We go over sleep, exercise 4 to 6 hours a week. Okay, level of intensity we figure out, but oftentimes moderate to high, depending. And all sorts of nutraceutical supplements that I feel that are very, very targeted to really make this environment hostile, right? So again, oftentimes Dr. Lepore or somebody from NYU would say, Geo, I saw your patient, he's doing amazing, his PSA's actually dropped. How do you treat prostate cancer with natural? I said, I don't know. I don't know that I'm treating prostate cancer. I'm treating their microenvironment, lowering chronic inflammation, making sure that their immune system, their NK cells are strong and powerful, reducing oxidative stress, detoxification pathways, make sure that those are working, and insulin resistance and those kinds of things, treating the person. Other things get better and so forth. So it's a fabulous thing, and that's with prostate cancer. But again, prostatitis and all these things. It's really fun. It's really fun.
Music to my ears. Music. Wonderful.
Yeah.
Oh my God.
Thank you.
I mean, we could go on forever, but I'm
can.
probably going to get this very soon.
You're going to get the cane.
I'm getting it
pulling you off the stage.
It was wonderful. Thank you, Dr.
Thank you.
Espinosa. It
Thank
was
you.
really wonderful.
My pleasure.
having you.
Thank you.